Hello, and welcome back to the Chamber Vibes podcast. I'm your host, Foster Garrett, Director of Marketing and Events for the Bedford Area Chamber of Commerce. If this is your first time listening to the podcast, welcome. Let me just tell you what's going on. So every week, I interview a different chamber member to find out what they do and why they do it. Recorded right here in beautiful Bedford, Virginia, broadcasting on Grove Street FM, and brought to you by Media Squatch. Before we get to the actual podcast, though, I do want to tell you about one of our upcoming chamber events, which is happening next week on July 25th from 5 to 6 p.m. We will be at Woods Goods and Mercantile, located right outside the town of Bedford, near the Bedford YMCA on 460 West, for a Live at 5 evening networking event. Woods Goods is one of my favorite stores in the Bedford area. They have been open for a little less than a year, but they are quite possibly the most splendid store in the Blue Ridge, in their own words. They have antiques, apothecary items, different artisans and vendors who set up. They have a whole plant room, and each room in their store is decorated so beautifully, and each has their different themes. So as you walk through the building, it's a very own experience. They also have a big backyard for festivals, and the family that owns it are so nice. They visited Bedford once and fell in love and moved their whole family, grandparents and all, from northern Idaho to live here and work here. So we're really excited to be out there on July 25th. This event is free and open to the public. You don't have to be a chamber member to come. So invite your family and friends. It'll be a lot of fun, and we'll have some refreshments for you as well. But you can find our full calendar of events on bedfordareachamber.com. We have a lot going on, especially coming up in September with our annual gala. So go on and check it out. If you have any questions, you can call us. I'll drop our phone number and other contact information at the very end of the podcast, so make sure to listen all the way through. But without further ado, please allow me to introduce today's guest, Ben Osterkamp with Centra PACE. Welcome to the podcast.
Thank you, Foster. I appreciate it.
Of course. It's good to see you again.
I know, it's been a while, right?
Yeah. Before we were on air, we were trying to work out the last time we saw each other, because it feels like it's been not that long, but I haven't seen you this calendar year.
I know, right? We were just saying, I check out the emails and try to keep up with the events that the chamber has going on. And I think that makes me feel like we hang out more than we really do. So,
well, that's good. Even that's really my goal with all my communications. I want people to feel like they're part of the chamber and in on everything. So that's good feedback. But you guys have been busy.
We have been. So just to kind of give a little bit of background as to what PACE is, PACE is an acronym. It stands for Program of All-Inclusive Care for the Elderly. Long story short, our goal is to help keep senior citizens independent and at home so they don't have to move to nursing homes or, assisted livings or anything like that. If a senior wants to stay home, which, let's face it, most seniors do.
That's true.
We want to assist them in giving them support so they can stay at home. So there's a lot of different things that we do in order to accomplish this. To give some history on PACE, it first started actually out in California in the 70s.
Oh, wow.
It actually started off in the Asian American community. In their culture, it's very, very common to have multi-generational households. People take care of their parents and their grandparents in their home and all of that. So back in the 70s, there was really a big cultural shift in our country to where both parents were starting to go to work. So before then it was, dad went to work, mom stayed home and took care of the home, but then everything started shifting a little bit. So now mom and dad were both out of the house. So what was happening was the kids were at school, mom and dad were out of the house working, and grandma and grandpa were at home alone. And as people aged and whatnot, that potentially became dangerous. We've all heard those horror stories of seniors, leaving the oven on or, accidentally setting their house on fire, or they're not taking their meds properly because nobody's overseeing it. So these things were happening. And, as Americans, we're like, oh, well, find a good nursing home for your loved one. And in their culture, they're like, no, we take care of our own elders. So they're like, we have to find a new way of doing this. There has to be a better solution because we are, just as a culture, we are not going to put our parents in a nursing home. So that's when the model of PACE began. And what they realized and thought of was, hey, a lot of these services that you receive in a nursing home or that an individual would receive in a nursing home, we can supply at home with the proper support systems in place. So that's the idea and the concept of PACE is a nursing home style of care in the home so you don't have to move. So There's different things that we do to accomplish that. We have aides that will go out to the house. We have CNAs and whatnot that travel around all day long. They help people with their baths, they're getting dressed. They even help people prepare food, light housekeeping, things like that. We also have a very robust transportation service where we have an army of bus drivers and buses, and they will pick people up and take them to their doctor's appointments. So many seniors don't get the medical services they need just because they don't have a ride. So we have vans and buses, take people to their medical appointments. And I think one of the things that really makes PACE unique and special is our adult day center. So we have multiple day centers around the area. And at the day center, you can get things that you would expect at a day center, like socialization. We always play games and activities. We plan outings. Get that kind of fun side of things. But we also have a full medical clinic at our day centers. So full doctor's office, like you would expect at any other doctor's office you'd go to. MD on staff. We have nurse practitioners, RNs, all of that. They can handle prescription refills, annual checkups, even sick visits. It is very common for people to call us and say, hey, I just woke up this morning. I don't feel well. I want to be seen by a doctor. We'll say, yeah, sure. We'll send someone out. We'll pick you up, bring you in, and we'll get you taken care of. So we have that. We also have a full physical therapy center so people can get that outpatient physical therapy service and environment all there at the day center. We also have social workers to help with paperwork and, helping people sign up for programs and things like that. We even have a dietitian on staff to make sure people are eating properly and things like that. Yeah. So, and there's a lot of other little things that we do as well to support people. But those are kind of, in my mind, I always think of like the three pillars of PACE is the in-home care, the transportation, and then the day center services. So, again, the idea is all of these different services are in place to support these seniors so they can stay home and stay independent and live the life they want to live. Because that's our goal.
That is amazing. It sounds like it's really a full service elder care system.
It is. And going back to the acronym, with it being a program of all-inclusive care for the elderly, we kind of jokingly say we're like an all-inclusive resort for medical care. You're in the program and now you have access to all this stuff. So
that's awesome.
So like an all-inclusive resort where, hey, once you're in, you have your room, you have your food, you have your activity, all that. The same way is true with us, where anything medical that comes along, we step in and help facilitate that for the people in our program, whether it be, scheduling a specialist. Because we know, hey, we have our doctors, they do a great job, but they're not specialists in every field, So we have partnerships all over the area with various specialists, whether it be heart doctors, lung doctors, rheumatologists, whatever. And we will set up those appointments and we'll transport people to them and make sure that the updates are sent back to us so that way we can manage their care properly and everything. So that we do take that all-inclusive nature of our program very seriously.
And it seems like your services are really flexible.
They are. So
which is incredible.
Yes, it is. So for some people, everybody's different. And I will say, that's one thing that we really pride ourselves in is that our services are not cookie cutter at all.
Yeah.
We really, before anybody joins our program, we have a team that discusses their situation and talks with the patient and make sure that we can build a care plan that they want and that they need. So those are really the 2 points that we look at when building a care plan. And a lot of times we'll balance in between having aides go out to the house and help them and them coming into the center. So for kind of, I guess you would say for like an average patient, which it's hard to say average, but for kind of your middle ground patient, we may have an aide go out to them once or twice a week and help take care of them for the time that they need. And then we'll also have them come into the center maybe a couple times a week as well. So there are even some people that want an aide to come out in the morning before they come to the center because they want to make sure they get their bath and get dressed and kind of get dutied up before they are seen in public, So that's always a lot of fun where it's like, oh, the aide needs to go out extra early, get them taken care of and ready before the bus gets there to pick them up to the center. It's just fun because, even as seniors, they still have that pride of like, hey, I want to be presentable in public, and that's great to see. And that's the way we want people to continue to live. We want to assist them in living the way they want to live. So we always gear it towards what they want. If somebody's just not interested in coming to the center very much, we have some people that are like, you know what, I'm a homebody. I'm just not really interested in coming in very much. We're like, okay, that's fine. We'll just ramp up the in-home aides more so that way you're still getting your needs met. But you don't have to come to the center if that's something you don't want to. We have other people that are like, I love the center. I want to come here every day. And we're open Monday through Friday. So, if there's a medical need there, and, we do our best to accommodate those kind of things. So it's, we're always shifting people's care plans to what they want and what they need. It's very much so not cookie cutter.
Yeah. And as you're talking, I'm thinking of a lot of things because the Bedford area, we have a lot of older folks living here. And so these topics of elder care and assisting seniors with what they need and providing them with programming that's really fulfilling for their lives, it's a hot topic. It's something that we're always thinking of. And there are always 3 different things that are underlying with issues with senior care: independence, control, and dignity. And I think that PACE addresses these three things really well, because oftentimes when people are considering what to do with their futures or with their parents' futures, it's terrifying because the roles are suddenly reversed.
Absolutely. You see so many times where we'll talk to families and they'll say, I don't even we'll talk to a child who's taking care of their parent. Mm-hmm. They're like, I don't feel like I'm their child anymore. I feel like I'm their caregiver.
Yeah.
And my whole life revolves around, okay, I got to go see mom because I need to go to mom's before work because she needs to get up, and I got to make sure she takes her medicines and fix her some breakfast. And I'll make sure I schedule a DoorDash for her to get some lunch. And then after work, I got to run over there and make sure she has her evening bath and make sure she takes her medicines again. And their whole life just starts revolving around taking care of their mom. And it's like, well, when was the last time you just had some fun with your mom? Like, mm-hmm. when was the last time she was your mom? As opposed to she's my patient that I'm caring for. And so you see this caregiver fatigue all the time. At least I do, because I'm in this industry. But and it's heartbreaking, but on this other side of the coin, when PACE or whatnot is able to come in and help them and give that medical support to their loved one, it's so amazing to see a child come to us and say, thank you so much. You guys have taken a huge burden off of me. Me and my mom went to the movies the other day, and I didn't have to take care of her, other than just, driving her there,
Yeah.
We were just able to enjoy our time. And she was my mom again. I wasn't her caretaker, So it's so cool to see how people's lives can shift when they get the proper support that they need. And you're so right with, independence and dignity and all of that, because so many people, they feel like they're losing one of those pieces when they choose to move to a nursing home. Like, well, now I'm stuck there. Yeah. I can't just up and leave whenever I want, or, I have to utilize such and such a services because of me living there and that sort of thing. And you're right. The PACE model is designed around keeping those pieces in place that people want. And we found that a lot of times there's this struggle in families where, the patient, the one who needs the assistance, is hesitant because they don't want to lose out on independence or dignity or one of those things. But then the family's like, hey, listen, we have to. We don't have any other choice. So, and you hate to see it when somebody goes up to a parent and says, you are moving to a nursing home because there's no other choice. And that's always a hard conversation, especially when mom or grandma or whoever doesn't want to. And what we found with PACE is that a lot of times we're the happy medium. We're like, hey, mom can stay at home and she sleeps in her same bed every night like she always has. But yet we're checking in on her. We're taking care of her. We're making sure her medications are managed. We're making sure she's refilling them at the right times. All that kind of stuff that you would, a lot of times, a family member would be doing. We're able to step in and help with that. So the family's happy because they're getting medical support. The patient is happy because their environment's staying the same. And we just found that PACE is a very good happy medium where all parties are happy, when in a situation where a lot of times people are thinking something's got to give, someone's going to compromise. This is just a bad situation, but we got to figure something out. There is another option. And a lot of people just don't know about it, which is why I'm glad I got to come on the podcast and just tell people about PACE, because so many people we're finding just don't even know that it exists. We opened a PACE center here in Bedford. It's actually what we call an alternative care site. It's technically a satellite branch of the Lynchburg office.
Gotcha.
The reason for that is because at the Bedford office, we don't offer some of the services that we will at the at our big Lynchburg office. So like there's no doctor's office in the Bedford office. There's no physical therapy center there. It's really mostly just day center support when it comes to activities and that kind of thing. But we just opened it back in the fall, back in September. And, the reason for that was we had people in Bedford that we were picking up and busing into Lynchburg. And, some of them really enjoyed it. They're like, oh, I love the ride. I love 460. I can see the cows on the side of the road. And that's great. Like the car ride can be very enjoyable for a lot of people, but other people were like, oh, I don't want to ride the bus for, 40 minutes, to downtown Lynchburg, that's, and I get that, I don't blame them for that. So we were really grateful to be able to partner with the Bedford Adult Day Center. They're across the parking lot from Bedford Memorial Hospital. And, we've been sharing that space with them. They actually have 2 very large day center rooms in that building. And what we found was that the adult day center was only utilizing one of them.
Oh, really?
Yeah. So we were able to come in and say, hey, can we use your empty space? And, and split the electric bill kind of thing. And it worked out really well. And it's been, we've found that there's a lot of need out here and that we've been able to help a lot of different people here in the Bedford area. And as we continue to grow, we just hope to help more and more people. And maybe one day as we continue to grow, we can expand that space and help even more. So
yeah, that would be awesome. And I think it's so nice when people, because we can always go to Roanoke, we can always go to Lynchburg, but depending on where you live here, oh my gosh, that ride is so long.
Staying home is so nice though.
It is so
Bedford's
nice.
Such a fun town.
It is.
It's so nice just to stay home,
Yeah, and people that live here are very passionate about Bedford.
Absolutely.
And keeping business in Bedford and stuff like that. So I really appreciate that Centra took the chance and y'all are partnering with the Adult Day Center. But if people wanted to learn more about PACE, who would be a good patient for PACE?
Like who would be a good, like if somebody was interested, like, hey, who is a kind of a prime candidate for the PACE program? Yeah. Yes. So I will say we do have some state regulations that regulate who exactly we can care for. You have to be over the age of 55. It breaks my heart. I've gotten many a call for people, hey, can you help my son? He has cerebral palsy, like it sounds like your program would be perfect. And I wish we could help, like, oh, he's 35, or whatever. Legally, we cannot help anybody younger than the age of 55. Gotcha. So you have to be over 55. You also have to pass a health screening that was set up by the state of Virginia. It's called an LTSS. It stands for Long-Term Support Services. It's a screening showing that you need assistance with a certain number of what they call activities of daily living or ADLs. So those are things like bathing, dressing, housekeeping, the ability to ambulate and move around, that kind of thing. So there's all these different things that the state sets as those are activities of daily living, things you have to be able to do on a daily basis just to support yourself. If you show that you need assistance with a certain number of those, whether it be complete assistance or partial assistance, depending on the situation, then you will, if you show that you need enough help, you'll pass that screening, and that gives you kind of clearance from a health standpoint to be part of our program. Gotcha. So you have to be over 55. You have to show you need assistance. Another thing that we tell people, it's technically not required, but we strongly recommend people have Medicaid.
Okay.
So I guess kind of our prime candidate would be over 55, need assistance, and lower income. The reason for that is there's 2 ways to pay for PACE. You can utilize your Medicaid benefit. They'll pay for it through long-term care Medicaid. Or you can pay out of pocket, private pay. But I'll say private paying is very expensive. The reason for that is through the government, we are lumped into what they call long-term care services, which is the same category as like nursing homes because of all the medical support that we offer. So because of that, they put us in the same bucket as nursing homes, and then they make us charge nursing home rates.
Oh.
So I think right now for the Lynchburg-Bedford area, for someone to private pay for PACE, it's around, I think it's $6,200 a month. And for most people, that's not affordable.
Yeah. For the listeners, I wish you could see my face right now.
It's very high. And it's one of those things where we wish that we had control over that, but we don't.
Yeah.
It's a government regulation. So nationwide, 99.5% of people in PACE are on Medicaid.
Really?
They're low income. So there is a small portion of people that will just private pay for our services. We have had people private pay for our services before. But I will say it is uncommon. But if someone's in a position where they're like, hey, money's not really a concern of mine. I want the services of PACE. Absolutely, come on, we'll take care of you. And people have done that. So, kind of getting back to the original question, a prime candidate for PACE, we're looking at over 55, needs support with activities of daily living, and lower income or on long-term care Medicaid. And one thing I will say is we've had quite a few people come to us and they're interested in PACE services, but they're like, well, I don't have Medicaid right now, but I think I might qualify. We know the rules with the state of Virginia as to what would qualify somebody for long-term care Medicaid, and we can review those with a patient. And if their intention is to join PACE, we can assist them in filling out those applications, that kind of thing. So we have a lot of people in our program that when we first found out about them, they did not have Medicaid.
Oh, wow.
But then we were able to assist them in applying and making sure that they were able to get their paperwork in and whatnot. So that way they could eventually join PACE once it was approved.
That's awesome. I think that insurance, especially Medicaid, Medicare, so
confusing.
One of the most confusing things that you can ever deal with.
It's crazy.
To have people that know what they're doing and know what you need to get done to get to where you're going, it's so helpful.
Yeah, and we work with departments of social services and whatnot in the various areas that we were in, and we built a good relationship with them. And you're exactly right, especially for seniors.
Oh yeah.
Some of these forms that sometimes they're like, oh, it's quickest if you fill it in and send it out online, and they're like, that can be hard. Or hey, can you scan this and send it in to us? It's like, well, I don't have a scanner. It's like, hey, well, Ben over at PACE does. He can send it in for me. So it's really great to be able to help these people out and get them the support they need. So
perfect. And you guys, even though you're new to Bedford, how long has Centra been doing PACE? What are the areas that you guys are in right now?
Yeah, so we actually just celebrated our 15-year anniversary in Lynchburg. So
congratulations.
Thanks. So we've been in Lynchburg for 15 years. And we also have, so after the Lynchburg site was set up and up and running and everything, we then later opened sites in Gretna and Farmville. Mm-hmm. So those are full service sites. They have all of those services I was talking about with the doctor's office, the physical therapy, the whole shebang. Our Bedford site was our first alternative care site that we opened, in that it operates under the umbrella of the big main Lynchburg site, but it just offers day support services. Mm-hmm. So for those activities, and we always serve meals at the day center, gotcha. So breakfast and lunch and things like that. So the Bedford site's an alternative care site. So that one's our newest one that we opened back in the fall. And a really cool thing that we've been in the process of working on is we are opening an alternative care site in Amherst. The goal is to have that open by the end of the year. That's what we're shooting for. So kind of a similar situation as Bedford, to where we have people out there that we're helping, but it's a long trip into the Lynchburg site. And it's rural out in Amherst, and there's a lot of people out there that could use some assistance, a lot of senior citizens out there. And we said, you know what, things worked out good in Bedford. Let's try it again, so.
Well, that's awesome. I'm glad that we're a success story.
Yeah, absolutely.
Well, just kind of getting towards the wrapping up, how many people do you have enrolled in the Bedford PACE now?
In Bedford PACE, last time we checked the numbers, we have 21 people enrolled.
That's awesome.
Yeah.
To start from 0 and get to 21 before you're even a year in.
Absolutely. Yeah. I think our goal starting off in January was like, okay, by the end of the year, we want Bedford to have 20 people. Okay. By the end of the year. And we've already exceeded that. So it's really cool. Well, it shows there's so much need. Like you were talking about earlier, there's so many seniors out here that need that assistance, that need that support. And we're able to show them, hey, there is another option out there other than just saying, oh, you got to go to a nursing home.
Yeah.
And people are hearing that. People are finding out about it. They're telling their friends, and we're able to step in and help.
That's awesome. And the transportation piece is key. I see your buses all the time, by the way.
Absolutely. So that's
awesome.
That's one thing I hear all the time in Lynchburg, because there's more buses there. I think we have about a dozen buses in Lynchburg.
Oh, wow.
And in Bedford, we have one. So all the time when I'm in Lynchburg talking to people, they're like, oh, I've seen your purple and teal buses driving around, but I don't really know what you guys do. And I'm like, well, let me tell you about what we do. So, that bus is amazing advertising for us.
It really is.
Because people see it going around town. They're like, oh, we don't really know what that bus is doing. And then they find out and they're like, oh, that's so cool. Like, yeah, I know someone who could use that. Because, let's be honest, everybody knows a senior citizen, whether it's just a family member or a friend or someone we go to church with. And, those conversations about nursing homes come up, especially as somebody gets older or they have health ailments. And that's and the goal of PACE is to be part of that conversation right there along with nursing homes or in-home care and that kind of thing. So we're getting there.
Well, good. We're happy to have you here. We're happy to have the happy medium of PACE.
Absolutely.
Well, Ben, is there anything else you'd like to add before we kind of hop off?
If anybody is interested in learning more about PACE, you can give us a call at our main number. Our number is 434-200-6516. That is our main number there in the Lynchburg office. And if you tell them you're interested in learning more about PACE, they will transfer you to me.
Well, perfect. Thank you so much for joining me today.
Thank you for having me. I appreciate it.
Of course. Well, if people want to learn more about the Chamber, our number is 540-586-9401. But you can also visit our website, bedfordareachamber.com, for more information about our mission and the perks of becoming a member. But we also have a full business directory of our membership on our website, which is helpful for finding all sorts of great things in the region, including PACE. But that's all for today. Thanks so much for listening, and keep an ear out for the next Chamber Vibes podcast.